When you think about it, sex and our sexual organs,
Hmm.
they've always been, well, hugely important in our lives.
Absolutely. There's that idea that we're always kind of decorating ourselves to attract others.
Right. A biological decoration.
Hmm.
And sure, procreation is the main evolutionary point, but
Yeah.
we connect for so many other reasons. Love, fun.
Human connection itself, yeah. And really getting the science behind these parts of us, it's so tied to our general well-being.
Exactly. So for this deep dive, we're looking at Sex Marks the Spot, Your
Hmm.
Sexual Organs. It's by Dr. Michael Roizen and Dr. Mehmet Oz.
Hmm.
And our aim is really just to pull out the key stuff, the core knowledge, to help you understand this, well, this crucial part of your health.
Yeah, we'll look at some common myths, cover the basics of anatomy, how it all functions, and importantly, some practical things you can actually do for your sexual health.
And look, we get it. Talking about sex can feel, private, very personal.
Definitely.
But the goal here is just to share important health info in a way that's hopefully approachable.
Okay, sounds good. Where should we start?
Let's kick off by tackling some of the big myths, the misunderstandings that float around about our sexual organs.
Yeah, okay.
One that really jumped out at me was this notion that humans are just consumed with sex because, well, we're just plain horny all the time.
Ah, right. And what's interesting is looking at that through an evolutionary lens,
Hmm.
the book points out that biologically our primary job is, reproduction.
Sure, pass on the genes.
Exactly. So after our prime reproductive years, which they suggest is around maybe 35,
Okay.
from that purely evolutionary standpoint, the body's work is kind of done, aging speeds up, we get more prone to disease. It's like, okay, you've passed on the genes, check.
Right. It does sound a bit cold when you put it like that, just the biological mechanic.
It does. But, and this is the crucial but, as humans, we're so much more complex.
Thank goodness.
Yeah, we value each other for, well, everything else, connections, experiences, emotions. We value older people for their wisdom. And, importantly, we've figured out that sex doesn't just switch off.
No expiration date.
Precisely. The book even has a playful nod to Sun City, Arizona,
Ah, yes, the retirement community.
where, let's just say, some seniors are reportedly enjoying their intimacy quite actively.
Good for them. So the biological drive is one thing, but our human experience is way broader.
Exactly. Way more nuanced.
Okay, another myth the book tackles. Only women have menopause.
Mm. And if you think about how hormones change over our lifespan,
Right.
it makes sense. Women have a more defined change, obviously, with menopause. But men, they also go through hormonal shifts as they age. It's just usually more gradual, maybe less clear-cut.
So like a male menopause, but maybe not called that as often.
Kind of, yeah. Sometimes called andropause. It's a real physiological change for men, too.
Good to know.
Yeah.
And the third myth, this is a big one, I think. Older men will inevitably develop erectile dysfunction. It's just part of aging.
Yeah, and this really hits on expectations versus reality. The book actually has some pretty encouraging stats here.
Oh, yeah.
It points out only about 5% of men in their 40s have ED. Now, that number does go up with age. Okay.
Maybe up to 25% by 65, perhaps over half by 80, but it's not inevitable, even after 80.
So what makes the difference?
A lot of it comes down to good arterial health. Healthy blood flow is key. In fact, they mention over 60% of men in their 70s still report having satisfactory sexual function.
Wow. Okay, so it's not just a given. Age itself isn't the direct cause necessarily.
Not necessarily, no. Arterial health is huge.
Okay, so we've busted a few myths. Let's get into what the book calls the anatomy of attraction. It seems like smell, pheromones play a surprisingly big initial role.
Yeah, it's fascinating. It's described less like a conscious choice and more like a chemical reaction. These compounds create sense, they make us attractive, and the signal apparently bypasses the thinking brain, goes straight to the amygdala, the emotional center.
So that's that instant chemistry people talk about. Hard to explain logically sometimes.
Exactly. It can feel very immediate, very instinctual. And sticking with the brain for a sec, there's this factoid. Something like 54% of men think about sex multiple times a day, compared to only 19% of women.
That's a pretty significant gap, yeah. Quite a difference in mental focus there.
Definitely. Okay, let's shift to the physical mechanics. Erectile function. Sounds like it's basically all about blood flow, right?
It really is. For men, stimulation kicks off a process, increases blood flow into the corpus cavernosum.
That's the spongy tissue.
Yeah, exactly. A network of it inside the penis. The arteries relax, let blood rush in, and at the same time, the veins constrict. That traps the blood, causes the erection.
So healthy arteries, healthy veins, Absolutely critical.
Crucial. And the book makes this really great point. The penis can almost be seen as a kind of dipstick for overall vascular health.
A dipstick. How so?
Well, the same mechanisms that control blood flow there, they're the same ones working everywhere else. Your brain, your heart, kidneys.
Ah, okay. So problems with erections could be an early sign of wider circulation issues.
It could be, yeah. An early warning that arterial health needs attention.
And we have to mention nitric oxide here too, right? That molecule we've talked about before.
Absolutely vital. Nitric oxide helps relax and widen arteries. That allows for good blood flow.
Right.
As arteries age, their ability to produce nitric oxide can decline. And that's a major, major factor in sexual dysfunction for both men and women, not just ED.
It affects blood flow to all the sexual organs.
Exactly.
It's interesting too how the view on ED has changed. It used to be seen as mostly psychological.
Yeah, that was the thinking for a long time. But now we really understand the huge role of these chemical factors, the vascular health.
But psychology still plays a part, anxiety, stress.
Oh, absolutely. Anxiety, stress, depression,
Hmm.
they can definitely contribute or make things worse. But the underlying physical health, especially arterial health, is foundational. It's not just in your head.
Makes sense. Okay, let's switch gears to hormones. Those chemical messengers doing so much. And testosterone, it's not just for men, right? Women need it too.
That's absolutely right. Women produce much less, of course, but it's still vital for their libido, their sex drive.
And levels decrease with age for women too.
Yes, they do. Natural aging, plus some medications can affect it. This can lead to things like less natural lubrication, thinning of vaginal tissues, which can, unfortunately, make sex uncomfortable.
And for female arousal, the clitoris is kind of the equivalent of the head of the penis.
Precisely. Highly sensitive and gorges with blood during arousal, just like the penis. A key center for pleasure.
And just like men lose testosterone, women's estrogen levels drop with age.
Right, and that drop in estrogen brings its own effects. Reduced lubrication again, changes in the labia's elasticity and thickness that can impact sensitivity, comfort.
So the book compares loss of libido in women to ED in men, like the functional equivalent.
In many ways, yes. It's the most common sexual health complaint for women, similar to how ED is for men.
It's also interconnected, and sex drive itself, it varies so much, doesn't it? Person to person over time.
Hugely variable. What's normal is such a wide spectrum. The book mentions how men often peak sexually earlier, maybe late teens, early 20s, while women often peak later, maybe late 30s, early 40s.
That's interesting.
And there's biology, too, like men being sort of wired for optimal sperm quality roughly every other day, while maybe a third of women experience dips in libido sometimes.
And that difference in desire that can cause real tension in a relationship.
Oh, for sure. And the book really hammers home the importance of communication here.
Talking about it.
Yes, openly, honestly. Talking about needs, desires. It's absolutely key for staying connected.
And we shouldn't forget estrogen and progesterone's role in the menstrual cycle, preparing the body each month.
The fundamental cycle, yes.
Okay, now, breasts, not strictly sexual organs, but definitely linked to reproduction, identity, pleasure.
Undeniably linked, yes.
And there's a common worry the book addresses bras or minor breast injuries causing cancer.
Right. And the current science, it really doesn't support that link. No solid evidence connecting bras or minor bumps to breast cancer risk.
But they hedge a bit, saying it's hard to rule things out completely.
Well, yeah. With complex diseases like cancer, it's always tough to definitively say nothing contributes. But the main takeaway is the evidence isn't there for bras or minor trauma.
Okay, and what about finding a lump? That's always a worry.
A huge worry. But the good news, the book points out, is that most lumps, like 80%, are actually benign, non-cancerous cysts.
Okay, that's reassuring. But you still need to get them checked.
Oh, absolutely. Always get any lump checked by a doctor. Cysts can feel similar to cancerous lumps sometimes. They're often linked to hormones, maybe more tender before a period.
Interesting. And the book mentions diet might help prevent cysts, reducing coffee, tea, cola.
Yeah, it suggests reducing methylxanthines found in those drinks might help some women. Worth trying, perhaps.
And what about changing breast shape without surgery? Possible.
Largely wishful thinking, according to the book. Breasts change naturally over time. Glandular tissue gets replaced by fat. Happens to men too, actually.
Right.
Leads to changes in size, sagging. Good bras, posture, pec exercises can help the appearance.
Sure, the support and muscle tone.
Exactly, but not fundamentally change the shape. And they add that smoking damages collagen, which affects skin elasticity, so that can impact breast shape too.
Good point. Okay, let's dive a bit deeper into menopause. We touched on the hormones. What are the key things to grasp?
Okay, so as fertility declines, the ovaries produce less estrogen and progesterone consistently. Eventually, periods stop. That's
Yeah.
menopause.
And the symptoms can vary a lot.
Hugely. Vaginal dryness is common, hot flashes, mood swings, memory changes, sleep problems. It's a wide range. And
Really?
again, worth remembering, men have that gradual hormonal shift too, the andropause.
Right. Now, hormone therapy, HT, used to be pretty standard.
It was, yeah. The idea was simple. Replace the declining hormones to ease the symptoms.
But now, more caution.
Definitely more caution. Research linked traditional HT to some serious risks, blood clots, certain cancers, heart attacks. So it's generally not the first thing doctors recommend anymore.
Are there cases where it is still considered?
The book mentions for women within 10 years of menopause with significant bothersome symptoms. Maybe. A specific low-dose type, usually with bioidentical estrogen and micronized progestin, plus low-dose aspirin.
But it needs careful discussion with a doctor. Weighing risks.
Absolutely essential. Individual risks versus benefits.
Mhm.
For women further past menopause or with milder symptoms, the risks usually outweigh benefits. And if women do take HT, the book says they should also take aspirin.
Got it. Any non-hormonal options for relief?
Some natural remedies might help some women, about 35%, the book suggests. Things like soy, red clover, black cohosh, also pace breathing exercises.
Interesting. And diet changes.
Yeah, they suggest cutting out saturated and trans fats might actually help reduce or even stop hot flashes for some, help stabilize blood vessel constriction and dilation.
Worth a try. Okay, let's focus on two specific organs. The cervix in women, the prostate in men. Cervix first vital for pregnancy and birth?
Absolutely vital. It's the lower part of the uterus, opens into the vagina, changes hugely during pregnancy and labor.
And the big health concern is cervical cancer. But it's detectable, preventable.
Highly detectable and largely preventable, especially caught early, which is why screening is so important.
And the main cause is HPV, the human papillomavirus. Same virus as genital warts.
That's right. Almost all cases are linked to HPV, and since HPV often has no symptoms...
You wouldn't know you have it.
Exactly. That's why regular pap smears are crucial for sexually active women. They detect HPV and any early cell changes.
How often?
Books suggest annually if no HPV history, maybe every 6 months if you've been treated for it or had an abnormal pap, but always follow your doctor's advice.
And the risk of getting HPV is pretty high. Over 50% chance soon after becoming active.
That's the statistic they share, yeah. Really highlights the importance of prevention.
And there's a vaccine now.
Yes, very effective vaccines available for girls and women, ideally before they become sexually active, but beneficial up to age 45 if not previously vaccinated. Protects against the main cancer-causing strains.
And a weird factoid about human milk potentially killing the virus.
Yes. A fascinating, though maybe preliminary, finding mentioned. Purified human milk having antiviral properties against HPV.
Okay, turning to men. The prostate. Walnut-shaped gland, urinary function, ejaculation.
Correct. And problems can show up as frequent urination, especially at night, pain, ejaculation issues.
And the big worry is prostate cancer.
Understandably. The book notes it's common in older men, but, and this is key, its aggressiveness varies wildly.
Some slow-growing, some not.
Exactly. Some might not need immediate aggressive treatment, especially in older men. Others, often in younger men, can be more aggressive. Then there's BPH, benign prostatic hyperplasia.
Which isn't cancer, but still causes problems.
Right. It's just an enlargement of the prostate. But it squeezes the urethra.
Hence the urination issues. Frequent need, trouble starting, not feeling empty.
Precisely those symptoms. And if it gets bad, urine can back up towards the kidneys, which is dangerous.
So treatment depends on what it is, how bad it is.
Exactly. Ranges from watchful waiting to medication or surgery.
Okay, let's talk about sperm and eggs, the basics of making a baby. And the book says the main cause of infertility is often just bad timing.
Surprisingly often, yes, just not having intercourse during the fertile window when the egg is actually available. The whole process is pretty complex.
Right. So women are born with all their eggs, finite number.
That's general understanding, yes, stored in the ovaries. And usually one egg gets released each month during ovulation, starts its journey down the fallopian tube.
And men, It's a numbers game.
Big number.
Millions of sperm.
About 300 million per ejaculation, typically, and then they have that incredibly tough journey.
Upstream, basically.
Exactly. Through the vagina, cervix, uterus, into the fallopian tubes. Though the tube's lining and uterine contractions actually help them along and guide the egg down.
So it's a race to the egg.
A race against the clock and against millions of competitors.
And that old question, are male sperm faster? Myth or fact?
Fact. Sort of. The book confirms male sperm, with the Y chromosome, are generally a bit lighter, less genetic material, so they swim slightly faster.
Oh.
But female sperm, with the X chromosome, are tougher. They can survive longer inside the woman's body.
So speed versus endurance.
Kind of, yeah. And the book stresses sex determination is complex, involves the egg's receptivity, too. And forget those myths about positions influencing gender.
Right.
Interesting point, too. More males are conceived and born, but they seem less robust early on, so eventually there are slightly more females overall.
But despite all those sperm, infertility is still a big issue, especially as couples get older.
It is. Affects about 7% of couples in their 30s, but jumps to around 33% in their 40s, and then way up to 87% by age 45.
Wow. What are the main reasons for men and women?
For men, it's often low sperm count, just not enough sperm, or poor motility, meaning they don't swim well enough.
Okay, and for women?
Can be several things. Uterine infections preventing implantation, problems with the egg maturing properly, blockages or structural issues in the fallopian tubes.
Stopping the egg and sperm meeting.
Exactly. Or fibroids in the uterus can sometimes interfere, and the book adds that stress. Especially the stress of trying to conceive can sometimes make things worse.
That's tough. A vicious cycle.
It can be.
And IVF, in vitro fertilization, is mentioned as a way around some of these issues.
Yes. IVF bypasses some natural barriers.
Yeah.
Eggs are fertilized outside the body, then transferred back, and they include a thought-provoking note about IVF cells being similar to those used in some stem cell research.
Interesting ethical point. Okay, so we've covered a lot of how it works. Let's get to the practical stuff, the
Yeah.
Live Younger action plan.
Right, the takeaways.
And the core message seems simple. Look after your sexual health for a longer, more fulfilling life. And number one priority, keep those arteries young.
Absolutely fundamental. Good blood flow underpins everything, including sexual function. Preventing arterial aging is key.
So action one, have more and more thoughtful sex. And they mean stress-free, safe sex.
Right. And interestingly, they link more frequent sex for men and higher quality sex for women to actually looking and feeling younger.
Younger? How?
The data they cite is intriguing. Like going from sex once a week to twice might make you seem 1.6 years younger. And high-quality sex may be up to 8 years younger.
Wow. What's the theory? Stress relief.
Probably a mix. Stress relief, better cardiovascular health, plus the emotional benefits, intimacy, companionship, oxytocin release from cuddling.
They even mention an extreme number, like 700 times a year, potentially making you 16 years younger, though they admit data is scarce there.
Yeah, probably not a realistic goal for most. And they mention calories, too. A typical encounter might only burn 25, but a longer one, maybe 300.
Look, a decent workout.
Yeah.
And being able to climb 2 flights of stairs is a good fitness indicator for sexual function?
Yeah, a simple gauge of overall cardiovascular health relevant here.
Okay, addressing that tricky issue of different libidos. The book emphasizes different experiences, right?
Yeah.
Men's and women's orgasms.
Very different sometimes. Men's often more external, maybe quicker. Women's more varied, internal. The key point for men is focusing on the partner's overall enjoyment, intimacy. Women absolutely get pleasure without orgasm every time.
And the timing difference. Men often quicker. Putting pressure on women is counterproductive.
Totally counterproductive, which is why they really push for longer foreplay.
Kissing, touching, connecting.
Exactly. Increases lubrication, satisfaction. Water-soluble lubricants help too. And for some women with low libido, maybe a topical testosterone cream could be an option, since T influences desire in both sexes and declines with age.
They even mention weird signs of low T. Less beard shaving for men, less leg shaving for women.
Yeah, slightly quirky indicators.
And activity does decline with age, especially for women, maybe due to fewer partners. But many active seniors still have sex regularly.
Yeah, plenty in their 70s and 80s having sex at least twice a month. To keep it fresh, they say experiment. New positions, places, fantasy.
And surprisingly, schedule sex. Doesn't that kill the mood?
The idea isn't making it a chore, but building anticipation, making time for intimacy, not letting life crowd it out. It can actually boost libido for some.
Okay. Also, get sweaty exercise benefits.
Lots. Male sweat might contain pheromones. Maybe. Exercise definitely cuts ED risk in men, reduces stress, which affects function and fertility.
And finally, strip, meaning.
Body acceptance. Feeling comfortable in your own skin is huge for sexual comfort and enjoyment.
Makes sense. Okay, action 2, use your mouth. Diet and nutrition, pantry is key.
Because overall health brain arteries directly impact sexual function, so food choices matter.
They highlight omega-9s and omega-3s for PMS.
Yeah, evening primrose or olive oil for omega-9, flaxseed, fish oil, walnuts for omega-3s. Specific doses mentioned. Calcium helps PMS too.
And for the prostate, selenium and lycopene.
Right. Selenium from foods like garlic, maybe supplements where levels are low, linked to lower prostate cancer risk. Lycopene, especially from cooked tomatoes.
Like spaghetti sauce.
Exactly. Cooked with fat is best for absorption, linked to lower risk of aggressive prostate cancer. They give amounts easier to get from sauce than raw tomatoes. But skip the fatty meatballs.
Why skip the meatballs?
Saturated fat is linked to prostate cancer cell growth. And that weird fact about selenium toxicity in Custer's horses again.
Okay. Other vitamins, E, B, C, zinc, folate.
Vitamin E might lower prostate cancer risk, careful with statins, maybe help vaginal dryness. Folate, B vitamins, omega-3s, zinc might boost fertility, sperm motility, uterine receptivity. Vitamin C helps sperm motility too.
Saw palmetto for BPH urinary issues.
Potentially, yes. Especially if it contains beta-sitosterol. 160 milligrams twice daily is mentioned.
And L-arginine, L-citrulline, for nitric oxide.
There's a theory, data isn't super strong yet, might increase nitric oxide, help blood flow, ED, sperm count, possibly helps arteries generally. Foods like almonds, cocoa, walnuts have them.
Okay. Action 3. Detect intruders. Regular checkups.
Crucial. Not giving direct medical advice, but stressing routine screenings for viruses, other issues affecting sexual organs.
Like prostate exams for men over 50 or 40 with family history.
Yep. Digital rectal exam included. And for women, regular pap smears, pelvic exams for HPV, cervical cancer screening. Frequency depends on history, doctor's advice.
And finally, action 4. Don't stop without a second opinion. This sounds important.
Really important. So many people, over half of men and women, have sexual function issues at some point, but far fewer actually talk to a doctor.
And if they do, they might just accept the first answer.
Right. The message is, seek professional help if you have concerns, and if the first opinion doesn't solve it, get a second one. Don't just give up. Sexual health matters.
Absolutely. So wrapping this up, understand the science of our sexual health. It's just fundamental for overall well-being for a fulfilling life.
Definitely. We hope you'll mull over this information. Maybe it sparks some questions or encourages you to explore things further for yourself.
And maybe a final thought to leave you with, now that you've got this deeper dive into the science of your own sex machine, how might you approach your sexual health going forward? What kind of decorating in that broader sense of really taking care of this vital part of you would you prioritize now?